Good afternoon, everybody. We're late today. It's 4:20. As if you're a frequent viewer, you know that we often have a Board of Estimate and Apportionment meeting, and that's at 2 o'clock on Wednesdays, and so that ran long for today. I do want to talk for a minute about COVID and then talk about a couple of other things that are important right now. If you've been following the news, you know that our COVID numbers are up across the nation. We seem to be in a third upswing, and that's the same here in this region, and in the city of St. Louis to a little bit of a lesser extent. So yesterday we reported 51 new cases in the city of St. Louis. Probably about another hour and a half we'll be out with the cases for today, but yesterday it was 51. The day before it was 66, 37, 51, 53. So what you can see is that over the last 7 days we've averaged about 51 cases, new cases a day. Number of people in the hospital, and these are regional numbers and they lag by 2 days. 372 people in the hospital 2 days ago, so that would have been Monday, COVID positive, and that's up considerably from where we were just a week or so ago. We were under 300. 86 people in the ICU. That's a bit higher number than we have been having. We had been down a couple of weeks ago. We were down to around 70 people. 44 people on ventilators, 55 people admitted to the hospital 2 days ago. So our numbers have increased, and I think that's to be expected because that's running that way all across our region, and frankly even worse in parts of our region, particularly in outlying counties, and those counties that do not have mask mandates and social distancing mandates, and who do not limit the size of events. Those counties are seeing even more, even higher increases than we are. So I know that everyone is tired of this. I know everyone's fatigued. Now really is not the time to stop wearing your mask, or I'm reaching for mine right now. It's not the time to stop wearing your mask. It's not the time to sort of let your guard down, because I think there's speculation. Of course, it is speculation that is people have been doing that because they're fatigued by this. Frankly, it's understandable. Everybody's tired of this. We've been in this pandemic for over 7 months, but we're going into cold weather here. That means more people inside, more people in close quarters, and we're frankly seeing the result of that. And we haven't even really had cold weather up until this week, when it's gotten a little chillier. So I'm concerned about what we may see a week or two from now as people are inside more. So please be vigilant for yourself, but also for others that are around you, your coworkers, your relatives, your family, your friends. Try to be vigilant. Wear your mask. We'll take your COVID questions in just a little bit. There are a couple things I thought you might want to hear about that we talked about at the Board of Estimate and Apportionment today. Maybe a few of you were watching. It's a pretty long meeting, about an hour and a half. It's not always that long, but we had 16 items on our agenda today. So let me just talk about a couple of them. This is an exciting one. Today we approved a contract with Behavioral Health Response to get up and running the 911 diversion program, as well as what we commonly call cops and clinicians. And what this is not every 911 call should be responded to, or is best responded to, by either a police car, a fire truck, or an ambulance. Many 911 calls are people that are calling for mental health services or social services. Some are in crisis, some need to be connected to social services, and so this program, which we're going to begin hiring and training on November the 1st, and it should be up and operational by the 1st of the year, is intended to divert those calls which really need mental health services or something other than a police car, fire truck, or an ambulance, something other than that, to divert those calls and to have a social worker, a mental health worker, a clinician help by responding to those calls and trying to connect people to services. So that is a $740,000 contract that we signed with Behavioral Health Services. Or was it Behavioral Health Response? I may be saying that incorrectly. Let me see here. Yes, Behavioral Health Response. The program was developed in connection with a lot of different agencies. So there was a lot of public input for the development of this program. And I had a list here of who they were, but certainly the Violence Prevention Collective was one of them. Behavioral Health Services, Integrated Health Services, I'm missing one or two of them, but all of those agencies came together to give public input and to help develop those programs, which we're pretty excited about. You know, there's actually over 700,000 calls to 911 per year. Now, you might have 10 calls for the same incident, and so, but the number of times that the phone rings is over 700,000 calls. And not all of them are dispatched because, you know, some of them are hang-ups and those kinds of things, but it tells you the volume of calls that are coming into that call center. And, you know, we hope to divert in a year 5,000. And you know, 5,000 is it's about 6 or 7 per day. If you look at it like that, 365 days, or maybe it's about 12 per day. So we think that'll be, most importantly, it'll be a better response for the person who's in crisis, to have the right response. And so we're very optimistic about the 911 diversion and the Cops and Clinician program. They go hand in hand, as you can tell. And so we're launching that, and just got that contract approved today. Oh, here's my note on that. Integrated Health Network, Children's Advocacy of Greater St. Louis, Violence Prevention Commission. So those are the folks that helped develop that. What else? Today at E&A, we gave an update on body cameras and in-car cameras for the police department. Some of you will remember, because we talked about it earlier in the year, that we have purchased body cameras for police officers. We have to date trained about 750 police officers. We are updating our computer system, our CAD system, because that has to be updated in order to allow those cameras to go on automatically when the lights go on in the car, or when you reach for, an officer reaches for a gun, and all kinds of situations make that camera go on automatically, so it's not dependent on a police officer remembering, oh, I got to turn on my camera. So that all has been coordinated. A lot of the uniforms have been purchased. This is a camera that slips inside your shirt here. So each shirt has to have be modified so that there's a hole for the lens to stick out of. So the shirts have been modified, but it's not just shirts. It's shirts, it's lightweight jackets, it's heavyweight jackets, it's all the different police uniform shirts and tops, I'll call them, have all been modified. That's well underway. We're thinking that as we undergo this enhancement to our CAD system and to our computer system, where all this camera will go, data will go into, that we're hopeful that by around the first part of December, we'll have most of these cameras deployed. And so it's something that we've worked on for a long time. It's a major improvement, and it's a major expense, but we know it's important, and so we gave a long update. Anybody can go back and listen to the entire update if you like. It's on the YouTube for the E&A meeting. What else for today? I think that's all. Do you guys have questions?
A couple questions, Mayor. You may have heard that Dr. Garza with the task force talked about how we've erased all our progress from over the summer. Your thoughts on that, and what the winter kind of looks like?
Well, erased all of the progress. I understand what Dr. Garza is saying, but we did have pretty low numbers over the summer. But those numbers have ticked back up here. And so I think that's what he's saying when he says we've erased the progress. But we did have those lower numbers, and we had fewer people getting ill. So that was still a good thing. It looks like throughout the U.S. and even throughout the world, we're headed into sort of a third spike. And so that's very concerning. And there's only one thing that we can really do, and that is change our behavior. And we know that we are having difficulty getting people to wear masks. Many of you have done a great job. Let me just start up front and say that. Many of you have done a great job. But we also know that this has been politicized to a large extent, and so we haven't been successful at getting everyone to wear a mask or getting everyone to social distance. And so as we go inside more, and as we expand our groups, I mean, the smaller your group is, the safer it is for you. But as we begin expanding out, because we're tired, we're fatigued, it's causing our numbers to go up. And I have to tell you, our healthcare workers are really fatigued and disappointed, I think, just working really hard, taking care of people, and then to see more and more sick people come into their hospitals is depressing for them. So we all need to stop for a minute, thank those healthcare workers, and understand that this can happen. You can get it. I can get it. We can all get it. And what we're trying to do is of course, keep as many businesses open as possible, because that causes people to lose jobs, and that's its own kind of struggle. So,
a couple questions about schools, Mayor. Kathy's question: have we had cases as schools have slowly returned to a little bit of in-person learning?
So in the city of St. Louis, and Dr. Eccles was on Monday, and he talked about that. We have not had large outbreaks in our schools at this point in time, and we hope that we don't. Dr. Eccles and his team have worked very hard with each school on infection control, and when that's done right, and when kids and teachers and staff are kept separated, you can go to school safely, we believe. And so he's been working with many schools on that.
Kimberly's question related to schools is, some schools in the county have decided to stay virtual for the second quarter. Do you anticipate schools in the city with a little bit of an increase in cases will make a decision to stay virtual or send kids back home?
I think that depends on each school. What we have in the city is we have some schools that are full-time in classroom. I think that's most of the parochial schools. We have some schools that have their kids split into groups, and one group goes to school Monday, Thursday, and the other group goes Tuesday, Friday, or something like that. So that's a split session. And then we have some schools that are fully virtual. And St. Louis Public Schools just went back to class in classroom for kindergarten through second grade. I believe it was last week. So everybody's trying to find their way. We know that there's a digital divide. We also know that kids, especially little kids, really do learn better in the classroom than sitting in front of a screen.
Tanya, on the numbers for our program.
So, excuse me, about 700 units the rent has been paid on about 700 units to date. Actually, checks cut. That's $1.4 million. Of many more in the pipeline, and those will be coming forward. Gotta get my water today.
Kate's question has to do with COVID. How many warnings for violations do businesses get before there's action taken by the city, whether it's warnings, fines, or a temporary closure?
So, warnings take different forms, and it depends on how egregious the violation is. Most businesses want to comply. When you talk with them on the phone or go visit them once, they come into compliance. If you have a business that is just consistently and persistently not following the mask mandate or the social distancing, then over time, those businesses do receive more severe restrictions. And occasionally, not too often, but occasionally, we do have to close those businesses for a couple of weeks.
Shannon's question is that she doesn't see the yellow tape on playgrounds anymore. Does that mean that playgrounds are safe for families and kids to use again?
Oh, Shannon, you must have missed that meeting. When was that? Maybe a month ago? So we, probably a month ago, maybe a little longer by now, we did take the tape down from around playgrounds. Frankly, we would put the tape up on Monday morning, and by Monday afternoon, in a lot of playgrounds, somebody had already taken it down. So what we've said to parents is that use your own good judgment. If you're going to allow your kids to play on the playground, be sure that you can, that you have wipes, that you have hand sanitizer. Dr. Eccles actually doesn't recommend it, but as a practical matter, parents were making that decision anyway. And I heard from some parents who were like, well, so-and-so's kids gets to play on the playground. And I said, well, at this point, the parent gets to decide that. We don't think it's the greatest idea, but if you do it and socially distance and use hand sanitizer and wipes and that sort of thing, that's up to you.
So on masks, Yolanda would like to know what she should do about businesses and employees that she sees that are not wearing masks, or maybe wearing them just under their chin, not covering their nose. Is there a way of reporting that to the city?
There is, Yolanda. We talk about this all the time, but so I'm going to do a little demonstration here. Sorry. So yeah, this is a chin strap. I'm not sure. It might help with that double chin, but that's not doing you any good. This isn't doing you much good either because your nose is still out. And so really to wear it, you got to wear it like that. You can report a business. All employees have to be wearing masks, and anyone indoors has to wear a mask unless they're actively eating or drinking, sitting at the table actively eating or drinking. And so you can report it through 622-4800 or through Twitter, STL, at STLCSB. And go online if you like. You can report businesses in that way.
We got a couple of questions submitted about 911 and Cops and Clinicians program.
Mm-hmm.
What are your thoughts on how it will benefit people in the city, people who call 911, people who need help?
Well, I think when you call 911, usually you're in a crisis of some type. Sometimes people even call 911 on someone else. Maybe it's a car accident, but when you call 911, hopefully you can get the right service. And not every 911 call needs to be answered by a police officer, a fire truck, or an ambulance. And so I think the benefit is trying to get that individual perhaps the mental health services that they need to get better. So I think that's how it benefits folks.
We piloted this program previously.
We piloted cops and clinicians, but we didn't pilot the 911 diversion. That's new. Cops and clinicians, we've done 2 pilots, but they were limited. Now this will be rolled out in 2 police districts. The 6th district for sure, and they're looking at some data to figure out whether it should maybe be a district south or maybe the 5th district even. So they're working on that. We don't have the funding to roll it out all over the entire city, but they are coming together with that right now.
Last question on that topic. How will the person answering 911 know if it still needs a police response or if it should be diverted to a mental health or behavioral health specialist?
Training. The people at 911 are, and that's part of what's going to happen over the next month or 2, is that they will receive additional training to identify those individuals that might be able to be responded to by a clinician or a clinician and a police officer. So that's all about training. And our 911 operators, as I mentioned earlier, they take over 700,000 calls a year. And they are highly trained. It's a very stressful job. We're actually trying to hire for 911 operators right now. If anybody out there is interested in being a 911 dispatcher, it comes with good training. And so go on the city's website because we are hiring right now.
A few more questions, Mayor. Heather is asking about businesses and restaurants that are impacted by the 50% capacity headed into winter, what the city's advice, ways the city can work with them to try and survive the colder months.
So I think it's, Heather, it's a very difficult situation. Our numbers are going up, so we really don't feel like it would be a good idea to increase the capacity limits, to give up on the social distancing, because we fear that will just spread the disease more. So for folks who have outdoor dining areas, of course, I know a lot of people are beginning to use the outdoor heaters. I think that will help for a while. That will help until it gets too cold, too very, very cold. But to be able to keep those outdoor areas open is a plus. And then to be able to have enough indoor area where you can spread the tables out significantly.
A few last questions, Mayor, on the election, which is 13 days away.
Mm-hmm.
Do you know how many people have voted so far, how many ballots have been received, and how voting is going at the satellite centers?
So a lot of people have been voting. There have been, let's see, total ballots received back, 19,000, right? And about 2,000 more, what does that say?
Mailed in.
Oh, mailed in. Okay, so 21,000 ballots have come back to the election board already, either absentee or mail-in ballots. And that includes the people that have voted in person absentee. Those are not all paper ballots. I'll just remind all of you that you can vote in person absentee at 4 library locations. Julia Davis Library, Booter Library South, Schlafly Library in the Central West End, or the Downtown Central Library. The hours for that voting are 11 to 5 on Monday, Tuesday, Friday, Saturday, and it's 1 to 7 on Wednesday and Thursday. So that gives people a little flexibility. And if you are voting absentee, of course you have to have a reason in Missouri. That's a state law, not our rule. If you have a reason, if you're over 65, that's a reason. If you have an underlying health condition, that's a reason. For COVID, if you think you're going to be out of town on election day, or that you might be out of town, your work may take you out of town, or you're just going to be gone, that's a reason. So I've made it pretty easy to vote, and having 21,000 votes in already, and we've got 2 weeks to go, 2 weeks from yesterday, that's a lot of votes. Now, I do want to say this. On election day, you can't vote at those libraries. You got to go vote at your normal polling place. The election board this year has sent out 2 cards. I've gotten both of them. The first card came out and said, hey, here are the libraries that you can vote in-person absentee at. That came out. And then yesterday or the day before, I got the second card, which is more what you would consider the normal card you get. It tells you where your polling place is, reminds you what the hours are, and just reminds you to vote. So the election board has done a great job. We did get a $1,032,000 grant this year to the election board to help with that additional mailing, those additional cards, to help us with the costs of the remote voting locations. So we're grateful for that. We just actually passed that grant today at the Board of E&A. But the election board has a lot of additional options for that.
Last question submitted today. We talked a lot about the restrictions and travel changes downtown. Is the city considering permanent changes to roads downtown, like speed humps, curb bump outs, making roads smaller?
So we probably aren't thinking about speed humps in downtown. That has to do with plowing the snow. It has to do with fire trucks. It has to do with ambulances and those kinds of things. Over time, I think most of us absolutely agree that our streets downtown are too wide, whether it's Market Street or Tucker, and there is planning underway to maybe do bump outs at the curbs to make those crosswalks shorter, that cordons off the parking area, maybe even to take some lanes for bike lanes. Those are all very expensive projects that if to do a major road runs many millions of dollars. So we don't have anything that's going to start right away with that. But if you are familiar with the downtown STL plan, that's certainly something that is in their plan as well.
That's it for today, Mayor.
That's it for today. Thank you all. Appreciate you being here. We're late today, but we'll be back and visit with you in a few days. Thanks. Bye-bye.